Hi everyone, how are you? Welcome to anatomy video, and today's topic is cecum. Cecum, it is located in the right side. That means it is the proximal part of the right colon. We know there are the different part of the colon, such as the right colon, transverse colon, and left colon. The right colon also divided into the cecum and ascending colon, and the left-sided colon also known as the descending colon, sigmoid colon. Uh, this type. So the cecum, it is part of the large intestine and part of the right colon, and it is located in the right side of the abdomen, and it is the first part of the colon. Then here it lies below the ileocecal valve, and it is intraperitoneal. So here we can see this is the cecum, this part is the cecum, and this cecum is located ileocecal valve. Here the ileocecal valve, so cecum is located just below the ileocecal valve. Here this is the ileum, and this area ileocecal valve. This is the ascending colon or right colon, then transverse colon, descending colon, and sigmoid colon. So this is the colon in short, and the cecum, it is located in the right side in the right iliac fossa, just below the ileocecal valve, and it is intraperitoneal. Then some other information which is important regarding this cecum. Here we can see important relation, some posterior relation and some anterior relation. Posterior relation, first of all, here we can see a muscle which is known as the psoas major muscle. So psoas muscle, it is located posterior to the cecum. Then another muscle which is the iliacus. So two important muscle which present posterior to the cecum. One is the psoas muscle, another one is the iliacus muscle. Then here you can see some important nerve, such as this is the femoral nerve, genitofemoral nerve, and gonadal vessels. So first of all, two group of the muscle, then three group of the nerve: femoral nerve, genitofemoral nerve, and gonadal vessels and nerve. And among them, the most important one is the gonadal vessels and nerve, because the gonadal vessel and nerve, they may be injured during the cecal mobilization or other operation in the right iliac fossa region. And here we can see anterior relation, greater momentum. So anterior relation is not more important, posterior relation is more important than of the anterior relation. And among them, the gonadal vessels and genitofemoral nerve and femoral nerve, these are most important. But among them, gonadal vessels and nerve, they are the first priority, because the gonadal vessels and nerve may be injured during the different procedure in the right iliac fossa. So this picture here, we can see this is the boundary of the cecum, this dot boundary here, this is the boundary of the cecum. And here we can see the important posterior relation of the cecum. Here we can see this is the psoas major muscle, and here iliacus muscle. And this iliacus muscle also present this area also, because it arises from the iliac fossa. Here you can see from here also this iliacus muscle arises, and this dot boundary is the boundary of the cecum. So these two important muscle, psoas major and iliacus, it here. And we can see three important nerve also present, such as nerve, genitofemoral nerve, femoral nerve, and the gonadal nerve also. Gonadal vessels, and here we can see this is the gonadal vessels. This one is the right side, as it is right side, it is the right gonadal vessels. So this gonadal vessel may be injured, genitofemoral nerve may be injured, femoral nerve may be injured, but among them the gonadal vessels are most prone to be injured. Then second one, genitofemoral nerve and femoral nerve. And muscles injury are relatively less common, because it lies most posteriorly and it is obvious during the operation, and it is identified very easily. So injury of the muscle is less common than that of the nerve and the vessels, and among them the gonadal vessels, femoral nerve, and genitofemoral nerve. Then artery supply, cecum is supplied by ileocholic artery, and this ileocholic artery, it is not direct branch of the abdominal aorta. It arises from the superior mesenteric artery. Then the lymphatic drainage, it follows the mesenteric node, accompany the venous drainage. And the cecum is most distendable part of the colon. This part is very important. The cecum is the most distended part of the colon, and in the body part, its breadth is more than the length. So the cecum is most distendable part of the colon, of the whole colon. In complete large bowel obstruction with a competent ileocecal valve, the most likely site of perforation is the cecal perforation. So among the whole of the large colon, there is the main site of perforation is the cecum. Here you can see the blood supply of the cecum. This part, this is the cecum, and this cecum is supplied by this and this artery, which is arises from the ileocholic artery, and this ileocholic artery, actually it is branched from the superior mesenteric artery. So superior mesenteric artery, it is supplied by the ileocholic artery. Ileocholic artery, it is branched from the superior mesenteric artery. And here we can see the venous drainage. This is the cecum, and this drains into the ileocholic vein. Here we can see this is the ileocholic vein, and this ileocholic vein finally drain into this vein, and this vein is the middle cholic vein. It should be superior mesenteric vein, so it drains into the superior mesenteric vein. So ileocholic vein, it drains into the superior mesenteric vein, and this superior mesenteric vein, it forms the portal vein. The ileocholic artery supplies the cecum and may require high ligation during the right hemicolectomy. So during the right hemicolectomy procedure, this ileocholic artery should be high ligated, and sometimes the ligation reaches up to the superior mesenteric artery. So sometimes the ileocholic artery may be ligated, or its main trunk, which is the superior mesenteric artery, may be ligated during the right hemicolectomy procedure, which is a large operation or big operation. And the middle cholic artery should generally be preserved when resecting the cecal lesion. Middle cholic artery, it supplies the transverse colon, so it should be preserved during the operation of cecal lesion. The superior mesenteric artery does not directly supply the cecum, it by the ileocholic artery. So we can see the superior mesenteric artery, it does not recess up to the cecum, it gives it branch ileocholic artery, and this ileocholic artery supplies the cecum. So thank you all. This is all about the cecum in short. Thank you all.